Okay, thank you very much. I'm Abebe from Ethiopia, and I'm gonna to present my presentation on skill-based care uptake among women from socially marginal minority, southern Ethiopia. And as introduction, in 2019, as it was reported that 295,000 women died of pregnancy challenges every year globally. Poor maternal health care service uptake remains a significant problem in low and middle income countries like Ethiopia. And in developing countries, maternal health care utilization varies due to different factors, with most significant showing difference between affluent and poor women, between women living in urban and rural areas. And also another studies indicate that socioeconomic and cultural factors such as women age, ethnicity, education, cultures, and the need for care, decision-making power of women have large impact on variation of maternal service utilization. As a statement of problem, in my country, Ethiopia, study revealed that poverty, literacy of women, monthly income of women, media exposure, decision-making power among women, distance to health institutions were significantly associated with the skilled birth service utilization. And also, study also showing that socially disadvantaged minorities are less likely to access skilled birthing service utilization due to their social status in the community. Skilled birthing or skilled delivery care utilization inequalities persist among vulnerable minorities because of the services are not socially and culturally sensitive to all. Thus, marginalized women are vulnerable to poor healthcare service, negative stereotyping of poverty, social status, parenting style, and unsupportive feedback from the caregivers or on service uptake contributes for poor healthcare service. Thus, the objective of my study was to assess the level of skilled delivery care uptake and social factors among socially marginalized minorities in the southern Ethiopia. As a methodology, we use that community-based cross-sectional design was employed. All postnatal women in socially marginalized minorities was considered as a source population. Study population were those selected postnatal women from socially marginalized community. Sample size was determined by considering single population formula was used to determine sample size. To determine sample size, the assumption was very clear: the 95% of considered confidence interval and 5% of marginal error plus prevalence of 29% from another study plus considering design effect of 1.5. We calculate to have adequate sample size for this study by considering non-response rate of 10%. Finally, we have had 521 participants were included in this study. As for sampling procedure, we to enroll the study population, multi-stage sampling technique was used because of how go to search at the household level. Sample size was proportional allocated for 3 rural districts. Then it also proportionally allocated to Currently level, that is the smallest unit of administration in our context. Study participants were enrolled using simple random sampling method, using their generic number from registration, ID number from registration of the women Government level, we do have data and health extension workers in each community. We had their number from that. Data was analyzed by we turned to EP4, then after we export for SPSS for analysis. All necessary statistical parameters was applied here and was by varied and multivariate logistic regression to determine association of independent variables with outcome variable. Variables with p-value less than of 0.05 was declared as statistically significant. As operational definition, social marginalization, we define that we operationalize that social distance of individuals. It may be individual, it may be a group of people that's excluded, discriminated, or subordinated to access the skilled delivery service in the community due to their particular lifestyle, particular culture they have, cultural community position, their community given them. When come to the result, I'm going to show briefly. From 510 participants, only 95 in person, only 19% of respondents responded that they have had a skilled delivery service in health facility. They show that around 18% of women have had their delivery service, gave birth at home, indicate that to work more among the socially marginalized minority in the southern Ethiopia. I tried to summarize the major findings, factors that associate with this. The low institutional or skilled birth care or institutional delivery. We had multivariate logical analysis showed that birth care service utilization among marginalized women was significant associated with their maternal education level, matters strongly associated with this, their education level, their occupation, and also awareness of birthing care, meaning awareness of delivery care at health institution, and the pregnancy plan, and the number of births they have so far, mother's life and their social discrimination level matters, that these factors are strongly associated with the utilization of skilled birth care in health facility. This is the table that showed that the association and statistical value. I tried to conclude in short the prevalence of the service utilization among those marginalized minorities was only 90% in steady area in Kabatu. So this is the steady area. The maternal education, occupation, awareness, skilled care, number of births, social marginalization level, discrimination level were significantly associated with the birthing service uptake in health facility. In conclusion, awareness creation on skilled delivery, institutional delivery is vital important, and also improving access to education is so very obvious that we do have very fantastic policies nationally, education for all, but in factual and the ground level, we do have huge gap to access all women to have educational opportunity. It's known that having education is important to make them productive, to increase them decision-making power. They will have, as you know, that having education is a very important tool to empower women in all aspects. So accessing education for all women is highly recommended, particularly in this marginalized minority, increasing probability of mothers. Increasing probability of mothers is vitally important as far as they are not productive, they will be dependent, they don't have chance to decide their own self, to access health services by deciding on their self. That's why increasing opportunity of availability is one of a highly recommended area based on our findings. The The last and very important point of our finding and recommendation is working to avoid social discrimination of that minorities. Even though those minorities are living in the same community, the southern part of Ethiopia, even the government policy not yet trust them because they are the community. Nobody differentiate the level of the discrimination, but in factual and reality, they are the least and the bottom of the community, and they have a critical disadvantage of accessing the health services, and similarly, they have low access to education, low access to health service, low access to economic sector. That's why working on social discrimination issue is very important to avoid this discrimination, to boost that community socially to the level to upgrade the social status in the communities. Highly recommended based on our findings. I think this is all about I do have for this short session. I thank you all for having your attention class. It's my great pleasure to share my experience and to learn from you. Thank you all for your attention. Thank you.